Ladies and gentlemen, our next category is a category which affects the lives of more than 1 billion Indians. We're talking about the Health Leader of the Year. The nominees are all exemplary in their fields. Dr. Manohar Krishna Dole, who's dedicated his life to providing eye care services to the underprivileged. The renowned microbiologist, Dr. Gagandeep Kang, who's advanced the study of infections, of enteric infections, especially among children. Rahul Kumar Verma, who's pioneered a novel approach for the treatment of CNS tuberculosis, and Pragya D. Yadav, who was among the scientists to discover the first COVID cases in the country. To give away the award, we'd like to invite back on the stage the jury member and former SEBI chairperson, UK Sinha, and Nidarshana Ramesh Govani, founder and trustee of the Kamla Ankibai Ghamandiram Govani Trust. Can I just invite them all to come up on stage for this very, very special award? Come, ma'am, please.
Please come.
Ma'am, go ahead and open it. Yeah.
Gagandeep Kang.
Gagandeep Kang.
I just thought so that you are the one.
Please come up.
It's a proud moment.
Congratulations. अब बात गगनदीप कांग की, जिन्होंने देश और दुनिया को बहुत सारे बच्चों की ज़िंदगी और सेहत के लिए बहुत बड़ा काम किया है। डॉक्टर गगनदीप कांग आंतों से जुड़ी बीमारियां जैसे कि टाइफॉइड आदि को लेकर किए गए उनके रिसर्च की वजह से इनकी वैक्सीन बनाना संभव हुआ। इस साल उन्हें इस रिसर्च के लिए गैडनर फाउंडेशन ने सम्मानित भी किया। हमारे देश के और अंतर्राष्ट्रीय स्तर पर भी स्वास्थ्य संबंधी जो नीतियां बनी हैं उन पर भी डॉक्टर कांग का गहरा प्रभाव है। तो बचपन के लिए काम कर रहे इस अदृश्य डॉक्टर को एनडीटीवी देता है हेल्थ लीडर ऑफ द ईयर 2024 का सम्मान। जोरदार तालियां। Congratulations.
Dr. Kang, I'm so delighted to finally meet you in person after having interviewed you at last count 12 times, but all during very challenging times when we were in the middle of COVID. We've spoken about Indian science extensively and the Indian healthcare system. How important is it for there to be profound science which makes a difference in India, which is Indian science? Because when it comes to research, it's often an area where we are lacking.
You've put your finger on it. In India, we tend to borrow our solutions from the West, and what we've been trying to do over the past few decades is for us to be able to frame our own questions about health in India and seek to answer them. So I'm really excited about the fact that we are finally doing that. We saw it during COVID, but this, I hope, is a revolution that will continue, because we do need to rely on ourselves to be able to solve our problems.
In your own field of work, Dr. Kang, are there any Indian scientists or is there any specific area of Indian research which excites you as possibly being an area which is world-beating?
I think there are two areas that I would truly like India to focus on, and they are related to my field. So solving tuberculosis in India, I think, is something that we do need to emphasize. It is the biggest infectious disease killer in the world. COVID beat it for 1 year, but it's back. And the other area I think is important for all people in India and around the world is nutrition. We have both under and overnutrition, and they are important problems for us to be able to address with science. One of the things that we have to remember is that in India we have traditional systems of medicine and traditional knowledge. We have not fully integrated that into healthcare.
डॉक्टर कांग, आपने बहुत महत्वपूर्ण बात अभी कही जब आपने ट्रेडिशनल सिस्टम की बात की है और मॉडर्न मेडिसिन है। अक्सर ये देखा जाता था कि दोनों में या लोग समझते थे या इस तरह की भावना थी कि टकराव है, पर वो टकराव जो है वो धीरे धीरे आपको लग रहा है कि कम हो रहा है और जो ट्रेडिशनल प्रैक्टिसेस हैं हमारे यहाँ और इतना वास्ट नॉलेज है वो इंटीग्रेट हो रहा है बेहतर?
Absolutely. And I think with the increase of more westernized lifestyle, we are seeing more lifestyle diseases. And if you look at our traditional systems of medicine, they actually are holistic in the advice that they offer in terms of diet, in terms of exercise, in terms of what people need to be doing. You know, yoga is union.
Of course, yoga is now recognized worldwide, but also I see a lot of times now that the traditional Indian diet is also recognized world over, and it's recently we did a report where the Indian diet was known as the most sustainable diet, probably. So that's a huge recognition. Another question I want to ask you is, you know, the whole field is where doctors, a lot of doctors are going for more profitable ventures. Research is left behind. So what really encourages you, inspires you to go into that research field?
There is nothing more exciting than the opportunity to ask your own questions and then figure out how to answer them. It's tough, but at the end of it, there is satisfaction like no other.
Dr. Kang, when we were discussing COVID a few years back, we spoke about mutations of COVID. We spoke about, we've had one disastrous Delta wave which killed millions of people around the world. And we were all very worried about what future mutations could be. Now in 2024, COVID is a part of the lives of billions around the world. It's like a common cold in many cases. Hopefully it is. But from your own understanding of COVID, a few years down the road, do you believe that it is far more insidious and the long-term consequences are something which will impact many?
I think we are learning more about long COVID and the consequences of viral infections. We clubbed it all as one syndrome, and what we are learning today is that it actually has multiple manifestations that can last long term. So there is a lot of work for us to do to understand the consequences of both single and multiple infections, which is the situation we are dealing with today.
Dr. Kang, quality of medicine manufactured in India is critical. I ask this because while we are the pharmacy of the world, there is a critical need for regulation of the quality of medicines which are being manufactured in India. I say this because there have been concerns when it comes to the export of Indian drugs, but equally it impacts people in our own country. When it comes to monitoring and regulation of medicines being manufactured in India across the country, where are we, and do you think more needs to be done?
Of course, more needs to be done, but that is the case for every country in the world. So this is what regulation is about. It is about improving quality, making sure that medicines are safe and effective. And that is a journey. You start somewhere and you keep trying to do better and better. It's really encouraging that our new DCGI and the Central Drug Standards Control Authority has really been focusing on this over the last several years. They've hired more people, they're getting more training in, they've started new laboratories. I think we are going to get better. We've had missteps in the past, but every industry has that. And we do need to make sure that we stay on an upward trajectory.
And ma'am, you know, we are broadcasting this, and there are young people watching. And many, many years ago, when you were a student in school, or you were a student in college, and you were interested in science, and you were interested in research, there would have been those, for example, your parents would have said, that sounds nice, but perhaps you want to be an IAS officer, or you want to be a doctor practicing medicine, or you want to be maybe an engineer. But you have turned out to be one of our finest researchers. How difficult was it for you to make that choice, and did you have that support that many across the country still need?
I was really fortunate that I had parents who were tremendously supportive. So as a woman who has worked her entire life, I couldn't have done it without the support of my family and friends.
ओके डॉक्टर कांग, आखिरी सवाल आपसे, आप एडवाइस देना चाहेंगी, कुछ कहना चाहेंगी, एडवाइस तो नहीं, इंस्पायर करती हैं आप इतने सारे लोगों को, लड़कियों के लिए खास करके.
I think to girls, the only thing that I have to say is that economic independence really matters. And if you can achieve that doing something that you enjoy doing, you are doing the right thing for yourself and for your family.
Thank you so much and many
Thank you very much, Dr.
congratulations
Kang.
to you. Thank you so much.
Congratulations.